And we are back with Dr. Malik Johnson. And if you're just joining us, he's answering all kinds of dentist-related questions for the next 15 minutes or so. All right, let's get to the questions that are coming in right now. The first one is, what causes dry mouth?
So dry mouth can be caused by a few things. We normally see it in older patients due to polypharmacy or multiple medications. A lot of our older patients are on 5+, sometimes 10+ medications. And we're taught that when you have 10+ medications, there's a 100% chance that you're going to have just issues in other places, and dry mouth being one of them, right? Some other things that may cause dry mouth are certain disease conditions. A lot of autoimmune diseases accompany dry mouth, as well as habits like smoking, mouth breathing. A lot of people who use CPAP machines and things like that have dry mouth. And if you are experiencing dry mouth, you should go see a dentist or ask someone about it, right? Because the saliva helps to fight off cavities and things like that. So if you are experiencing dry mouth, you're probably more prone to cavities and having issues with your teeth.
Okay. This person says, what would you say if you've not been to the dentist in a long, long time due to a previously bad experience at the dentist?
I would say come see me, right? But also you want to tell your dentist what that bad experience was, right? Why you're scared, what it was that turned you off from the dentist. And sometimes we can work on those things. Like if it's, oh, I don't like the noises, then I'll encourage you, wear your headphones and I just tap you. If you felt like someone didn't get you numb adequately and just went in, a lot of patients say they just went in and ripped my tooth out. Well, let me know because I'll make sure you're super numb and I'll be super gentle. So just have these conversations. Don't be scared to the point where you only see a dentist when you're in pain, right? Because how can we show you a good time if you only come and see us when you're in pain?
That's right. All right. This next question is, how safe are implants and how expensive is it to get an implant? Who's getting implants? Maybe you can start there too.
Who's getting them? Well, anyone can get them, right? But first, there's a checklist of things, right? We have to make sure medically that it's safe to do. So if you have certain diseases, osteoporosis, autoimmune diseases, stuff like that, implants are not going to be necessarily for you because your body's going to fight against the implant, right? So many people can get them. A lot of people who've had single tooth loss, like one extraction in the back or even in the front, are perfect candidates for implants. You have one little area you're trying to replace. But again, you have to be medically, you have to be in good health. Your bone has to be in good health. You have to have good habits. A lot of smokers, if you're smoking packs of cigarettes a day, you're not going to be one of those people who we plan implants for because it's just not safe. It's not the right thing to do for you. In terms of how much they cost, that ranges typically to actually place the implant. It's anywhere from 2,000 to $3,000, $4,000, and then the actual tooth on the implant is normally another 12 to $2,200 type of thing.
Okay, so these are expensive procedures and things of that nature, but I'm sure that there's payment plans and there's different ways for folks to work that out as well.
Absolutely.
All right, this person is asking, does an elderly person's teeth naturally get brittle and break off because of aging?
Not solely because of aging. A lot of times, the things that come with aging are things like dry mouth, things like being less or being malnutrition, like not getting enough nutrients and proteins in, um, and things like that. It's not just surely with age. Of course, our bodies change drastically with age. We know this, but as you're getting older, if you want to continue to do right by your teeth, I'll say definitely take care of them. Soft toothbrush, brushing 2 times a day, drink plenty of water. Um, take your vitamins. Just do things generally for your health, and you should see that the more you tend to your health, the more your teeth will also kind of hold on in there.
This person says, I soaked my teeth in peroxide for about 30 minutes, maybe once or twice a week. Is that a healthy practice?
So it sounds like they're talking about dentures. And soaking your teeth, we do recommend soaking your teeth. Normally, there is a solution you can buy from the store, um, normally called a polydent or something like that. There's little tablets that you can drop into the denture water and soak them in that. I have recommended peroxide to patients who may not have that. Peroxide is a good cleaning agent for the mouth, right? So for your dentures, it'll also work. I wouldn't do a lot of peroxide or just peroxide. I would do mostly water and, put a little peroxide in there, and I would soak them for about 30 minutes to an hour and then take them out. There's no need to, have them in there any longer than that.
Okay.